Alert at Frankfurt Airport. A passenger from the Far East is believed to be carrying an infectious disease. No one wants to see a repeat of the SARS, or Severe Acute Respiratory Syndrome epidemic, that began in November 2002 and ended in June 2003. Were it to happen, maximum safety precautions would be essential. The pathogen could be highly contagious and extremely dangerous. The earlier it can be diagnosed, the better. It's also vital to establish how infectious it is and how fast it's likely to spread. Scientists at the Max Planck Institute for Dynamics and Self-Organization in Göttingen have developed a mathematical model that will make it possible to predict these factors in the future. For the first time, they can predict how an epidemic can make its way around the world. They've taken the SARS virus as their example. The scientists collated vast amounts of information about past plagues and about the recent outbreak, including how many lives were claimed. In comparison to previous models, what makes the program special is that it takes into account data from the global air travel network. More than 2 million flights per week between the world's 500 biggest airport hubs. The Göttingen scientists also included passenger numbers. The scientists' calculations largely tally with the actual spread of SARS. They can also tell how fast other epidemics would spread across the globe. The world's busiest airports, such as those in New York, London, and Frankfurt, play a key role in the international spread of infectious diseases, regardless of where a new disease first occurs. Airports are a nightmare for public health officials, especially when they're not prepared for an emergency. The Max Planck Institute's new model would make their work much easier.
One idea is to create a device that can be used with any PC that's actually fairly low precision, but which is 80 to 90% correct. Then, you're just a mouse click away from finding out if there is an infectious disease and how it will spread over the next 90 days.
Gottschalk, Stadtgesundheitsamt. Guten Tag, Herr Brockmann.
Disease experts keep a keen eye on outbreaks around the world, assessing the likelihood they might spread around the globe. René Gottschalk is a public health official responsible for Frankfurt Airport. He's been working together with the Göttingen scientists. He's confident their model will help him answer plenty of important questions.
How would the spread of a disease change if you implemented certain epidemic prevention measures, such as exit controls? During the SARS epidemic, body temperature measuring controls were introduced at the gates. These sort of aspects could be incorporated into the model. So before the pathogen actually emerged, we could calculate how it would spread and how it might change. That would be enormously useful in our work. We'd be able to tell if it was worth taking action or not.
A world pandemic is a very real threat. If the bird flu virus in Asia merges with a human virus, it could give rise to a new strain of supervirus. The airport doctor in Frankfurt might be the first to encounter cases in Germany. He would have to begin implementing safety precautions immediately, not forgetting his own safety. Face masks and gloves would be vital. The flu virus can be passed on by coughing, sneezing, and even speaking. If the suspicions are confirmed, disease experts have to act swiftly. In the future, the Göttingen program might prove an indispensable tool.